I'm happy to be a part of that as well.
Great. And Cam?
Hi, I'm Cam. I'm the oncology
Cam, we can't hear you. Can you just say that again?
Oh, I said I'm Cam. I'm the oncology research associate at IMB. I'm also with Fidel and Lauren, so I think I will let them introduce themselves now they're here.
Hello.
We're a little
Hello.
Cam.
I'm Fidel. I'm a physician at Butaro Center. I'm a PI in that project, co-PI with Dr. Ridia. And yeah, that's all.
And hi, everyone. I'm Laura Haskins. I'm the oncology nurse educator here at Butaro.
Wonderful. And I know there's two of you there, but Jessica?
Hi, Jess Cleveland. I'm a program manager here in informatics at Dana-Farber, but I've worked with Sarah for many projects over the years around quality improvement. So I'm very happy to be part of this effort, and it's nice to meet you all.
And I'm Sarah. I'm the Vice President of Quality and Patient Safety, and I'm very excited to hear how the first stage of training went and kind of getting the teams into their projects.
Hey everyone, I'm Anatoly Manzi. I'm the Deputy Chief Medical Officer for PIH, but I also lead the Health System Strengthening and the Quality Improvement at PIH.
Great. Hi, everybody. I'm Lauren, and I'll introduce Hubert, who just stepped out, but we work to help coordinate the oncology program based in the PIH Boston office. And Lori, I think most people know you, but you're the last one.
Yes, you're right. I know everybody, so I don't think I need to introduce. I'm walking by the cows.
Great. So Monty, maybe I'll turn it over to you.
Yeah, thanks. So, hi everyone. I think this is really a great opportunity to touch base on the training, but also really talking about the next steps. So first of all, I think we have some updates. I know you are curious about what happened with the training. So we will have a brief update on the training, and I think Laura will have a time to share with us, and Laura was present as well. And after that, we will probably spend most of our time on next steps. How every time I get involved in the quality improvement, it's the training is the easier part of the initiative. So how do we really make sure that we have an effective implementation, and what are the best practices, and we can share that piece and make sure we have a clarity on what role each one of us is playing to ensure that that happens. So I guess really part of the things we wanted to discuss, one is updates on the training and the workshop, and the second will be to really review the implementation timeline. Probably these goes together. And coaches' roles and responsibilities, because now we are getting into the active, implementation. So it will be helpful for the coaches to understand what roles and responsibilities, and this is very critical for the project, but also for the IMB leadership. I see David being there. It's really important to understand how we are providing support, but also we're really coordinating with the leadership team at IMB. So those are the two or three important points. So Laurie and Laura and others. So in terms of updates, I have one summary, which is, really the training was fantastic. Obviously, we need to unpack that to share with those who were not part of the training. So I guess as one of the trainers, I really enjoyed the training, and everyone was engaged. Dr. Fidel, Dr. Patrick, and others were super active. So I would have probably asked Laurie to share a little bit about the updates and the timeline as we discussed. Then we will get into spend more time on the coaches' roles and responsibilities. How does that sound, Lori?
That sounds fine. Can everybody hear me okay?
Yes. Yep.
So we held four one-day sessions. Our hope was to target everybody who worked in oncology and some of our closest friends in other departments. We didn't meet that 100%, but we ended up treating I've been working in clinic all day, sorry. We ended up training 40 individuals in the one-day training. And I think it was really, really helpful to have breakout sessions and have people do work in groups. I feel like that engagement with the participants was very positively, a positive experience for everybody. So I think that was great. And then our in-depth 2-day training, which Manzi taught, was really excellent. We had good attendance. We had a few more people than our 3 quality mentors. We had Cam, Laura, Dr. Fidel, who all 3 are on this call. They attended, as well as a couple of our other doctors, 2 of our other doctors. And again, I think the breakout sessions and working on a fishbone and trying to put a problem statement together, and all of those things were really, really helpful. I think one great pieces of news is that all 3 of our teams have held their first team meeting this week. I think that they all were well attended, and the groups got a lot of work done. And David, thank you for your presence and assistance with 2 of those meetings. I wasn't at them, but heard that they went very well. So I think that we're off to a good start. I do think that we are expecting the teams to get through defining their problem and also through the measurement and analyzing phases of the QI process and begin to think about change ideas. And then the next training, which Jessica will do, we are targeting for the week of May 11th. And we will solidify those plans hopefully in the next week or 2, where they will learn more about the PDFA cycle and continuing to plot their data collection and also sustainability. So I think we are off to a good start. Yeah. Laura, do you have anything to add, or Fidel?
Laura or Fidel, do you have anything to add?
Yeah. Okay. So I attended the two of those presentations. The one for Olivier for the missing late chemostatin, and the one for Freddie about to implement the imaging for cancer staging. All those went well. We redefined again the problem statement and even how will be called the project, exactly what will be done. So most of them we planned like the next meeting in 2 weeks to come, and today for those meetings mainly it was about the selection of the team and what will be the role for everyone in the team, and we included for most of those two team, we included even the team, two other members from the administration for the supporting. And I contacted the DG, Dr. Tarsis, will be involved in the team of Dr. Fred about the imaging, implementation of imaging. And for the team of Olivier, Dr. Patrick, the clinical director, will be one of the team. So essentially, the next meeting will be like in 2 weeks to come, and the calendar is about two time a month for every group. Thank you.
That sounds so great. Fidel, can you say again what the teams, just briefly, what the teams are working on problem-wise?
The FREDI team, it's about to implement the imaging for the staging of all cancer for solid tumor. Actually, we have chosen just for solid tumor, excluding liquid tumor, hematologic tumor, because we need essentially the imaging for solid tumor.
So like whatever imaging is indicated based on the protocol.
It's essentially it's a chest X-rays and abdominal ultrasound. Sometimes we might include even CT scans following on base of case in the other case.
So in addition to that, I think, just correct me if I'm wrong, in addition to that one, there's also one looking at late chemostat. Yes, and second on the missed rendezvous, missed appointment. Is that correct?
It's for the other team. Yeah, for the three teams. For Fred, it's about imaging.
Okay.
For Olivier, it's late chemostating.
Mm-hmm.
And for Esperance, it's missed rendezvous for pediatrics team, for pediatrics ward. About the missed rendezvous that affected the chemo, like the outcome of missed rendezvous for the people who are to be on chemotherapy, for kids on that chemotherapy.
Awesome.
Can I ask a question about the late chemo start? Do you mean late time of the day, or do you mean delays from diagnosis?
No, it's a late chemo starting from the day of administration of chemo.
Okay. You kind of reframed it as calling it a waiting time.
I see.
From when the patient has in the morning from after the staff meeting, and then the amount of time the patient has to wait before the first chemotherapy is administered.
I see.
All right. I guess that's really super helpful. So I wonder, Laura, do you have any other comments either on the training or the meeting that you just had recently?
Just to say that the meeting I attended, people were super engaged and had a lot of great ideas, and I didn't understand all of it, but they were definitely very engaged, and that's exciting to see.
Awesome. Okay. Yeah, I think that's really helpful. Again, just being mindful of the time, it would be really good to also, talk about the post-training, what are we going to do to ensure that we have that effective implementation. And I would like to, first of all, before we get into the coaches and mentor role and responsibilities, I want to make sure that everyone knows which team we are coaching or mentoring. So I don't know if that will be helpful for you. Then once we know which team, we can get into more details.
I think that would be really helpful to assign the team.
So I can ask Lori and And Lauren here could help to read who are the mentors and who are the coaches for each of these 3 projects.
So hi everybody, it's Lauren. I can send this around to folks so that it's clearer and it's written down too. But just to briefly go through them, on the late chemo start or the waiting time for patients, Lori will be the advisor, and then Spiros, who is actually not on the call today from Dana-Farber, will be the coach. And then Hubert will help support from Boston as needed. For the missed rendezvous in pediatric with Esperance, Dio will be the clinical advisor, and then Jess Cleveland at Dana-Farber will be the coach. And then for the staging, imaging before treatment, Lydia will be the clinical advisor and Monty will be the QI coach. And then my understanding is David will be helping us with everything all the time, which is another, again, a great resource.
Yeah.
Does that make sense to everybody?
Yeah.
And to add on that, go ahead, Lori.
So I'm sorry, Lauren, I think you might have an outdated team list.
Okay.
And it's probably my fault. So let me send you the updated list, which you can circulate to the group. It's just a little bit different. It's just a little bit different than what you said.
Okay.
Awesome. Yeah, so if you could send an updated, it would be great, because, I think it's time that mentors and coaches would have, questions, and it would be really good to think of a specific project. So maybe once we have that list, Lori, we may have to ask more questions, or we can always, have individual kind of, one-on-one discussions. So here the idea is that we have the mentors, so a mentor for each group. And with the mentor, we have a coach and we have a clinical advisor. Most of the primary clinical advisors we have 2 clinical advisors, one on site and another one we see someone who is based in the US or out of Butaro. I guess this requires, to be effective with that structure, requires really a streamlined coordination and understanding what expectations we have from everyone. So I guess the next part of our discussion is really thinking about what is our communication schematic, but also deliverables from each of us. So, Lori is going to send the list. I was going to ask Lauren to share the list of the mentors. And again, this can change, but the updated list will be sent right after. I guess Lori is sending that. So in terms of mentors' role, really mentors provide the kind of every single inputs and technical support needed by the team. And the goal is really making sure we provide mentors with the support they need. And that's the goal of having a clinical advisor and a coach. With the clinical advisor and a coach, there's a difference I foresee, but you may have your understanding as well. The coach provides especially the technical quality improvement methodology inputs. And these are the people who would provide more work closely with the mentors to review their charter and make sure that they provide some inputs on, what change ideas they're proposing, and really the KY methodology, and really provide that KY technical support to mentors who are on the sites. We thought that the coach could schedule a one-on-one meeting with the mentors, but when it's needed, there's a possibility for the coach to attend the team meetings. So we can always decide when, but ideally, you know, having opportunities to a mentor, to coach the on-site mentor will be the primary responsibility for the coaches. And as you know, not all of us are really confident clinically to provide technical support. And that's where when we have the clinical advisor, and the clinical advisor we have here, they are people who are already, you know, expert in the subject matter. So I find it helpful when the coach and the clinical advisors, if they have some interactions as well. And especially when I am meeting with the team as a coach, when they bring about issues that are very clinical that I don't necessarily understand, it would be really helpful if we could organize a joint meeting where the clinical advisor and the coach could meet with the mentor and all the team, the entire team. So that really brings a comprehensive support provided to the site team. So we are basically positioning ourselves to answer both technical and the key why, that kind of more systems of thinking, and really review the quality improvement methodology that we want them to implement. So I will stop here just to see if you have any questions. Otherwise, this is a discussion we can always brainstorm. And we will also get into coordination. How do we make that happen? You know, because we don't want coaches and the clinical advisors to take a lot of emailing and you know, paperwork. So we thought about a system that could help. But before we get into that coordination system, it would be really good to hear if there's any questions regarding the coach and advisors' roles here.
Monzi, I just wanted to say I do unfortunately have to go because I couldn't, as I mentioned, I have this retreat in Somerville, and anyway, so but I look forward to hearing, maybe someone can follow up with me with instructions. I think the plan sounds awesome so far, and I'm really excited to work with everyone, especially David, who I worked with in like 2011 to 2014 or something.
That's great. Thanks, Lydia.
Thank you.
We will circulate notes and the follow-up.
Thank you so much.
Awesome.
Okay.
All right, and it's being recorded, so this will be.
Oh, that's great. Perfect. Okay. Yeah, I'll listen to it.
Awesome. Thanks, Lydia. So is there any questions? David, I know you have been involved with this for several years. So the idea is having a coach working closely with a site-based mentor, but also liaising with the clinical advisors. It's a triangle coordination or support system. So I wonder if there's questions before we get into more details. We may not read the entire job description, but I thought it was clear to frame it that way. And Laurie, jump in if, I know we had a discussion on this, so feel free to jump in. All right. It sounds like it's clear to you.
Lori, are you trying to speak? It looks like you are, but maybe you're muted.
Sorry, I'm facing inherent challenge here. Can you come again?
Go ahead, David.
Yeah, I was telling you that. I was telling you that except facing internet challenge here, but I was very excited to work and support these teams because according to my expertise in QI techniques and methodology, and I really appreciate that the entire team, the clinical expert, quality improvement techniques expertise, and I think this coordination triangle, as Man said, will work well as well. But I can suggest not waiting the deadlines that I saw on the meeting schedule. For example, I have attended 2 projects about waiting time and what else? And imaging.
Yeah.
And we have been talking about how we can get baseline data, especially for the waiting time. I have tried to draft a kind of paper chart where we can use write down according to different steps that the patient go through to track where we can get stuck. So this is it's been revised, and I think I'm still waiting for the inputs from Rora and CAM and other team. So this is what I can say about that.
Awesome. That's very helpful. I think that's actually one of the areas that coaches will need to start helping the teams, because most of these projects will require a baseline, and the idea is that the coaches would work with mentors to really design tools to help if needed. Ideally, we would minimize any new data collection, but unfortunately, these are projects that do not have a routine data collection. So to your point, David, that should be a top priority for the coaches to work with you and teams to really figure out the strategies and tools to collect the baseline data.
Sure.
So I guess we basically, this was just an overall, because it wasn't, I thought it would be good to clarify that. Hey, Laurie, do you want to say something? Yeah, there must be an issue with the internet. So really that explaining how this is going to work is really important. And I'll eventually, what we anticipate is having either bi-weekly or monthly meetings. So we thought it would be really good to have, initially, we could have a bi-weekly meeting between the coach and the mentor, and possibly have a monthly meeting when the coach could join the team meeting. The time frame could change. I think Laurie and I had a discussion. The timeline that could change depending on the availability of all of the coaches. But the idea is to have to meet frequently initially, and moving forward, once teams are really running the project smoothly, then there's a less need to have meetings. But initially, we want to have either bi-weekly meetings, then a monthly meeting. So bi-weekly with the mentor, and monthly with the entire team. Laurie, did you make any adjustments on the timing?
No, I think the assumptions, and I just sent everybody the document that we shared with the team here of who's on the teams, and then just a timeline of the next several weeks, giving the QI mentors ideas of their agenda items for their first, second, and third meetings. And the assumptions that we have are that the QI teams will meet at least twice a month with their Butaro advisor. The QI mentors, coach, clinical advisor, Butaro advisor, and logistics support will meet at least once a month or more frequently as needed. And that the QI mentor here in Butaro would send project material completed to date to the logistics support person who can share it with the team before meetings, so that people will have a sense of what's been accomplished since the last time that you heard from your teams. Does that make sense to everybody?
I think this is really helpful. This is actually very well drafted. So everyone who can pull it up or maybe read after a call. But the idea, Lori, the idea is to make sure we provide that hands-on support to mentors, but also we provide some technical support, especially during the first 3 months. I found that every time we run projects like this, the first 3 to 6 months are always challenging. So I wonder if any other coaches have has issues or questions or suggestions on this.
Hi, this is Jess. I think everything we've talked about so far in terms of the role of the coach and kind of being that QI methodology, technical support sounds great, and I think is where my expertise really is. And to hear David talk about the data collection being the immediate need, I think that sounds great. And per the schedule that Lori just sent out, you know, I think immediate next steps in terms of my team would be to have that first call to get up to speed with what the team is thinking about so far in terms of measuring the missed appointments that are happening in pediatrics. So everything sounds great. I think, you know, to your point, ramping up, we'll probably need to meet more frequently, and I think it's fine with that. I'm really happy to work with you all and to support and provide as much help as I can. So.
Awesome.
And I think having a schedule that really lays out the first few weeks for the team, sometimes getting started is almost the hardest part.
Yeah.
I think that really helps them kind of know what's first, what's next, sets the expectations for what to have ready for their calls. I think that'll be really good. And obviously, they do their root cause analyses and decide variation amongst the teams about what their next steps are. But I think having it laid out for them will be really helpful
Awesome.
to get them started.
Yeah, I agree. So, so I think in terms of coordination, obviously the goal is, Lori and I had a discussion. I think we want to minimize the amount of work that we take over, we take on, especially the coaches. I am super busy, and every one of us is busy. So we want to minimize that, but also have a coordinate. So we don't want documents, run charts sitting in different locations. And we thought about the coordination teams. So Lauren and Hubert could really help with scheduling these meetings. Not only scheduling the meetings, but also making sure that we fulfill our responsibilities. So that being said, prior to the meeting, if we have to read the run chart, so Hubert and Lauren will make sure that we do some pre-work, done. And, right after the meeting, if there's any action items, Hubert and Lauren will help us to follow through. With that being said, it would be pretty much a central coordination team. So this really helps us because in my experience, I had a huge project in Liberia, 2-3 years ago. And it was super helpful to have a team dedicated to that coordination and follow-up. So Hubert and Lauren will work closely with David, who is here, to make sure that we basically have all these projects well documented, but also the meetings are scheduled, either individual a coach mentor meeting or team meetings, or if necessary, organizing one call like this where all the coaches and the clinical advisors are meeting to discuss. So Hubert and Lauren will really help us to do that. So I don't know if that's the model this is what we thought was really effective and building on our experience with the past projects. But if some of you propose or suggest to have a separate approach or different approach, let us know. I guess that means yes. Yeah, so so I think it is really helpful. I think thank you, Bill and Lauren, for helping us with that. So with that being said, we would like to, so Lauren, are you trying to say something in terms of scheduling meetings or coordination, overall coordination? Yeah, I guess we have issues with internet. Laura, did you have any input? I know you being there, you know what works, what doesn't in terms of coordination. So did you have any inputs on that?
Monty, are you asking me or Lauren?
I asked you first, then Laura.
I think that the QI mentors are just going to have to stay in close touch with Hubert and Lauren to send out like Zoom meetings like this. As you can tell, I think from the team that is on the Zoom call, sometimes we don't have good internet, so calling in might work better for the people who are here. But I think it would be great to be able to have that logistic support from Lauren and Hubert. So thank you very much.
Awesome. So I guess this is a really, it sounds like logistically we are all set. That was, to me, that was my big challenge, taking on that support without, a kind of central coordination team. So I'm really glad that this, Hubert and Lauren are going to help us with that. Laura, did you have any other comments, especially being based in Butaro and logistics challenges? Do you see any other areas we need to streamline to make it easier for the team?
No, nothing specific to add.
Okay. Well, so we have 10 minutes left, so it would be really good to now really talk about next steps, especially I know one is really having these first meetings happen. Back to coaches' responsibilities, Lori and I had suggested, if possible, to let the mentors and on-site clinical advisory team to attend those meetings. So we suggested, this is optional for the coach to attend. And the reason being that this meeting is going to be in the Kenya, Rwanda, and probably, the teams need to kind of spend their time brainstorming. So the first meeting, we suggested coaches' attendance to be optional. So, it would be really great if mentors and coaches could schedule their first meetings to understand what came out of these meetings and possibly give the mentor some inputs and support needed to improve their design, because they are now in the design phase. So I wonder if Lauren and Hubert could liaise with each coach and a clinical advisor to plan for a first meeting with the mentor But that could happen. That would happen right after the first meeting, with the first team meeting. So just to review these preliminary ideas and provide some insights. I wonder if that makes sense. If so, then we could probably ask Hubert and Lauren to schedule that. So basically, a first meeting, clinical advisor, a coach meeting with the site-based mentor, just to review the draft, the first draft of the project. Is that okay for everyone?
It's okay.
Yeah.
Awesome.
It's okay for me. Yeah.
Awesome. But Dr. Fidel, I think this requires eventually to have the first meeting would be important if all teams had a chance to run their first meeting. So it would be really good if the teams could have their first meeting, then we could inform Lauren and Hubert to schedule the first coaching meeting. So I don't know what time frame works best for you. Because the sooner the better. So the sooner we have these meetings, the better. Because we don't want the meeting to happen when they have the final version. So it will be too late for inputs.
Hello?
Yeah, we can hear you.
Yes. From what I have attended, I think like the next meeting to happen like in 2 weeks to come. The problem like for the imaging team is like the mentor is likely to start his leave soon and to come back in 2 weeks. So I'm working with him just even for to design match for the project and going into to get the way to design even the baseline information we need in terms of to get the baseline of the study data. Then because I think like from in the 2 weeks of March we have that first meeting. And on another point, it's like on the logistic point of view, with the people from PIH, Bosco especially, we thought like we can get the first meeting to be organized on a day like a Friday, and where we have not much clinical work, and people might that might happen the same day for the 3 different teams, though they will be working in different each team with the same each members. You get me? Can you get me?
Yes, I think that makes sense. I think that so scheduling meetings when there's no or there's less clinicals, I think that sounds like a good strategy. So to confirm what you just said, these initial meetings will happen, within the next 2 weeks. So eventually the first coach, clinical advisor, so coach and a clinical advisory team, the first meeting could basically anytime after those 2 weeks, you will be you'll be ready to have that meeting. Is that correct?
Exactly.
So Hubert is going to follow up with you to schedule that. And we'll liaise with the clinical advisors and the coaches to take on their availability as well. And then ideally, if we could pick whatever recurrent days, so it may not change all the time, that would be helpful. So it could be the second Friday of the month. And ideally in the morning, Eastern time, Boston time, because we know that it's, Rwanda is 6 to 7 hours ahead. So I think it would be really helpful if the coaches could liaise with Hubert and Lauren to know what time works for them. And in that case, we could forward those times to Dr. Fidel and the team. So, and another next step is, you know, from what I understand, is helping with baseline assessment. I guess Jessica will, Lori, did you say Jessica would be in Rwanda soon?
Not until the week of May 11th when we do the second training.
Yeah. So we probably, coaches, one of the discussions coaches will have is to advise on a baseline assessment. I wonder if there's a possibility for Jessica to join some discussions, especially to start advising on what tools to capture what measurement for the baseline. So I wonder if that could happen even prior to May in one of the meetings, one of the initial meetings next month.
Yeah, this is Jessica. I'm more than happy to schedule a call and go through kind of how to collect data and what tools there are available for doing that.
That would be great.
What, say, like, you know, end of March or so?
Yeah, I think at realistically looking at what Dr. Fidel just shared, the first coach mentor meeting won't happen until mid or late March. So if you could join these meetings and having this as one of the topics on the agenda to really discuss data collection tools and plan, that would be great.
Sounds good.
Awesome. So I guess we are wrapping up the call. So I can see Lauren and Hubel are going to schedule these meetings. Is that we head back to all of us to to capture what times work for us. And Dr. Fidel is going to work with the team to organize the meetings within the next 2 weeks, and eventually we will have probably a detailed schedule so that everyone could understand what, when, and where to have the meetings. So Lori, I probably would pause here. I think we are all set in terms of the initial meetings and the roles and responsibilities. But let me know, or if you have any other comments. I know we had a long discussion last time.
No, I think that's great. I think, like I said earlier, we got off to a great start here, and I think now's just the time to connect everybody with advisors and coaches to help the projects along the path. So thank you very much, Manzi, for leading. Thank you, Sarah and Jess, for being on the call, and Dio and the team here in Butaro. I know it's coming up on 7 o'clock and nobody's had dinner yet. So thank you, everybody, for coming together for this call.
Thank you, Lori. I think we better let you have dinner now. So thank you so much, everyone. I hope we can plan for another call as it is now, especially to see how things are going. I will work with Hubel and Lauren to schedule another call like this, and really setting up a system. So we will probably have back to you through emails.
Great.
Awesome. Thank you so much, everyone.
Thank you.
Thank you.
Thank you very much.
Thank you.
Bye.
Bye.
Bye.